One thing to just touch on this before we move through the day today, because I know my time is probably up. Your lungs, we call it cardiopulmonary system for a reason. Cardio, heart, pulmonary, lung. The heart pumps blood, which is oxygenated. It gets the oxygen from the lung. These are linked systems. If you have lung disease and it is not diagnosed appropriately or treated appropriately, it is intimately related to your heart function. All right, so do not ignore asthma, because you can and often do have a modified heart muscle because or some modification because of your asthma or lung tissue changes. So they are not separate systems. We are a unit and they are linked. If you breathe better, your heart doesn't have to work so hard, right? So I highly recommend exercise. But I don't want anyone here that's not used to exercising to go out and overdo it. I want you to incrementally increase your exercise. Start with walking around the block. Do that for 6 weeks. What's 6 weeks of your life? Then the next 6 weeks, it's a block and a half or 2 blocks. Be very patient, and all of a sudden, you could theoretically be walking very quickly for miles from nowhere. So I think that's very important. Secondly, if you are weakened or have heart disease already, and you know it, which is some people in the audience, there are a few things that I would try to avoid. In general, I would try to avoid poor sleep patterns. Try to really think if you're sleeping well or if you snore, right? How do you sleep? Very important question. The other is, don't underestimate the power of Mother Nature. When it's very hot or very cold, your heart has to work in a way that could be straining to you if you already have heart disease. So that's reasonable. The number one time for certain folks that have vessel problems to have heart attacks in the Midwest and the East where it snows is they go out early in the morning in the cold and they constrict their vessels and they have a heart attack. It's avoidable. Know your disease, know what the limitations of your disease are. And those aren't meant to scare you. Those are meant to empower you to make decisions that are good for your health. That doesn't mean don't exercise, clearly. But know your disease. Now, I had a big list of things to talk about, and there's no way I'm going to talk about anything other than, I don't even know, one point on the graph. Maybe, if we're lucky. What I would like to do in part 2, if you don't mind, maybe there's a way to do this. And I have a blank piece of paper here. It says physician progress note. Just ignore that. Maybe I'll put this in here, and there'll be a few pages. Just put on here if there's a disease you want discussed about treatments. We didn't talk about treatments, right? If you want a disease explained and the treatment for that disease, and I'll pick the one that has the most hits. So if you say high blood pressure or hypertension, just put it down, even if I have 10 of them saying the same thing instead of a tally system. Put down what you want to know about on this paper if you wish on the way out. And then I can discuss that. My job through the VNA and otherwise is dealing with modified heart muscle and modified circulatory systems that have been damaged by disease. Yes, being 110, 105, and 95 means you could have a little bit of insufficiency to your heart. That's not a disease, that's being old. All right, we and I'm not blowing that off. We still treat that, all right? But sometimes it's more than that, and we need to understand if it's more than that, and what to do even if you are 105, and what meds to take, right? So these are questions. I don't care what the question is. I mean, except, do I have pets or something? Maybe that's not the appropriate thing. About heart disease, and just put it on the list. About a medicine, a name of a medicine. I don't care what it is. Write it on here, and I'll try to incorporate it. I don't even know when I come back. October 24th? All right. Actually, maybe I do know when I come back.